Hey, welcome to another video from SkinnyMedic. I want to do a quick video for you guys talking about cold weather injuries. I really want to kind of focus on frostbite for this particular video. It's wintertime here in the US and these injuries are going to be more and more common. So I wanted to kind of give you some information for your first aid prep so you can kind of fall back. So where can we find these injuries most commonly? Are going to be in our hands, like our fingers, our feet, toes, even the ears and the nose are the most common areas you're going to find these particular injuries. And what is frostbite? So frostbite is when the cells start to freeze. So our body is made of mostly water, even including the cells. So inside here, our fingers, they actually freeze and they crystallize. So when they crystallize, no foods, no nutrients is going through, no oxygen, nothing like that. So muscles start to die and bad things start to happen. So keeping that in mind, a couple of things we can do to treat these. One, kind of the overall picture is you're going to treat this very similar to a burn for a fracture. We can also try to warm the extremity up. Now, there's a caveat to that, and I'll explain in just a few minutes. So a couple of things we don't want to do. We don't want to rub the fingers once we have a frostbite. And you can Google pictures of what frostbite looks like, but it looks really nasty because the tissue is dying. So you don't want to rub the hands together, rub your ears, rub your feet, things like that, because you've got crystals in here and you're going to cause tissue death and more damage because you've got crystals you're breaking apart and rubbing. So once you have the frostbite occur, don't want to be rubbing the extremity. We're actually going to treat it like a fracture here in a few minutes. And then you actually want to avoid giving the patient coffee and cigarettes because those cause vasoconstriction, meaning that the vessels in the body start to constrict down, and that's going to impede blood flow, restrict blood flow, and that's a problem for us as well. So no warm coffee and don't give them a cigarette. So how do we treat these? Okay, so we're going to treat this like a fracture, like I said, and also these look like burns. If you'll Google the image, you'll see they look like burns. So we're going to treat them that way as well, with sterile gauze and then bandaging. If we have the ability to warm the extremity in warm water, that's an option. Now I said there was a caveat to that, and I'm going to explain. If you're going to warm the injury, that's what we're supposed to do, but you don't want the chance of it refreezing. You're going to cause even more damage to the body by doing that. So if you're going to warm the extremity and there's no chance it's going to refreeze, that's our game plan. But if you're like, man, this may refreeze because I've got to transport you 2 miles out in the woods or whatever, then don't warm the extremity. So if we're just going to bandage it because we're afraid that it may refreeze, then cover it with sterile bandaging like 4x4s, gauze, things like that. Clean bandaging, sterile if you have it, and then treat it like a fracture. Put a splint on it and carry on with your normal business on treating the patient. But if you can rewarm it and it's not going to refreeze, that's what we'd like to do. So you're going to need a thermometer because you're going to want your water between 104 and 108 degrees. So you need a thermometer for this. Warm the water up. This is like warm bath water. Put the extremity down in there and keep an eye on the water. When the water drops below 104, take the extremity out and then rewarm the water back up and put the extremity back in. This is going to take about 15 to 30 minutes to do. The extremity is going to be thawed out at that time, and then, like a burn, like if you had fingers that had frostbite on them, I would probably put some sterile gauze in between there, bandage it up, and just split it like a fracture so you can get to the emergency room or seek expert consultation on that. So that's some things to look out to. We're definitely in that time of year right now. So I hope this video helps. You never know when you'll be the first responder, wearing the right gear and the right training.